On Friday, President Biden announced that he is continuing the national emergency that was declared by former President Trump back on March 13, 2020. Now, this is all about the coronavirus. Now, this is despite the fact that, look, infection rates are down. 70% of the American public says, look, it's time just to decide we got to live with this and let's go on with life. And many, even blue state Democratic leaders, are saying enough of this, we've got to move on. Well, in his notice, he stated the COVID-19 pandemic continues to cause significant risks to the public, to the health and safety of the nation. But are we really in a similar position to where we were back in March 2020 when COVID-19 was new and there was no vaccine and we didn't know how to treat it? Joining me now to discuss this and more is U.S. Senator Ron Johnson of Wisconsin, who is a member of the Homeland Security and Governmental Affairs Committee and a member of the Commerce, Science, and Transportation Committee. Senator Johnson, welcome back to the program.
Hello, Tony. Great to be back.
All right, so what's your response to the president continuing this national emergency declaration?
I don't understand why he's doing it. Again, you go back 2 years, there's so much we didn't know about the coronavirus, COVID, the disease, but we've learned an awful lot. There's still a lot we don't know, but we've learned an awful lot. And I think one of the things we've learned is this isn't going to go away. So does the president expect to keep America in a perpetual state of emergency, a perpetual state of fear? I think the biggest blunder of our response to COVID was the fact that we did not robustly explore early treatment. I talked to doctors that successfully treat patients, so they've been doing so for the last 2 years. They've been saving lives. And yet our healthcare agencies, I call them now the COVID cartel, the administration, the agencies, big pharma, the legacy media, big tech social media giants, the COVID cartel has prevented and sabotaged early treatment. And I personally agree with doctors who said it cost hundreds of thousands of people their lives.
Yeah, that's one of the things we've learned in this process, that we've had bureaucrats step in between a doctor and patient. And so based on that, you've actually introduced legislation, the Right to Treat Act, which says if a drug has been approved by the FDA, then a physician, based upon his knowledge of his patient, should be the one to determine what treatment that patient receives, not some bureaucrat in Washington, D.C.
Yeah, this piece of legislation should not have been required. I championed Right to Try, which was all about giving people the freedom to use a drug that is not fully FDA approved. This just basically codifies what is already should be the reality, is that if there's a fully FDA approved drug, doctors have the right to prescribe that off label, which, by the way, 20 to 25% of all prescriptions are prescribed off label. They're prescribed for a condition other than the one that they're originally approved to be used for. The other thing my piece of legislation does is says the federal government should not interfere and should not regulate the practice of medicine. That is up to doctors. Doctors ought to be at the top of the medical treatment pyramid. Right now, because of COVID, they're at the very bottom, and they're being crushed, and patients are being crushed.
Senator, isn't that a part of practicing medicine? Isn't that how we perfect the process, where we allow doctors who are treating particular diseases or ailments, that we allow them to treat, not someone who is sitting back behind some desk in Washington, D.C., calling the shots for, I have to say, for political reasons?
Yeah, if I'm going to go get treated for an illness, I'm going to go to a doctor that actually has the courage and compassion to treat an illness, not some bureaucrats, not some academician in an ivory tower. You know, the term practicing medicine really hit home to me when we had our first daughter who had a very serious congenital heart defect. Her life was saved by doctors practicing medicine. The procedure they performed on her, rebaffling the upper chamber of her heart, they've now advanced that to where they do the atrial switch, which was about a 50% mortality back there 38 years ago. So I am personally affected by the practice of medicine, of doctors who've dedicated their lives to saving other lives, being at the top of the medical treatment chain, not at the very bottom.
Well, again, speaking of things that we now know that we didn't know 2 years ago, according to a new study in the Journal of the American Medical Association, Pfizer's COVID-19 shot is associated with 133 times greater risk of heart inflammation for teenage boys. Isn't this something we should be concerned about, especially when we're mandating these vaccines for so many people?
I've been concerned about what the CDC's own safety surveillance system, its early warning system, has been flashing for months. Back when it was like 3,000 deaths reported on VAERS. Now we're up to 23,990 deaths reported on VAERS, 1.1 million adverse events. And the CDC, the FDA, NIH just shrugging it off like, oh, there's nothing to see here. Again, I realize VAERS doesn't prove causation, but 30% of those deaths have occurred on days 0, 1, and 2 following vaccination. It's certainly something I think they ought to be exploring, something I'm concerned about.
Well, Senator Johnson, I appreciate the fact that you, despite the criticism you've come under, continue to draw attention to this with the experts. It's not commentary. You're bringing the experts in to testify on a number of occasions, and we're grateful for that. And thanks for coming on today as well.
Stay well.